Welcome. This webinar is for the recent graduate programme part of the Langford Academy. It's free to our members, so please go to the website and sign up. In this webinar, we're going to be talking about abdominal emergencies, specifically haemoabdomen. So let's look at our patient. We've got a 12-year-old female neutered labradoodle. The owners report she was not herself this morning. She wouldn't get up. When they did manage to raise her, she was weak and wobbly on her back legs. She didn't want her breakfast, and this has all happened since yesterday evening. On physical examination, she's incredibly pale. Her mucous membranes look like in this image here. Her capillary refill time is prolonged. She's tachycardic with weak pulses. Her respiratory rate is increased and there's some effort. She's normothermic, but she has a distended abdomen. So I would urge you to just pause the video at this point and try and answer these questions and consider your answers. We want to investigate what our next steps are, how we would manage her, and how we would stabilise this patient. So our priorities are probably getting IV access and getting an intravenous catheter placed. We might consider some pain relief, some analgesia, because we're not sure what's going on in her abdomen, and we'd probably use an opiate and short-acting. And we might also provide oxygen through nasal prongs or flow-by until we know whether there is significant cardiorespiratory disease present. Once we've got an IV catheter placed, we can perhaps pull blood and get some emergency database numbers, a PCV, total solids, and perhaps look at a blood smear. We can also decide, based on our PCV, do we think this dog is anemic and there could have been some hemorrhage, and we might consider a fluid bolus in case she's hypovolemic. So 10 to 20 mL per kilo bolus of an isotonic crystalloid, and then we would reassess and look at the heart rate, the capillary refill time, and her pulse quality. If we've got IV access, then we might also consider, do we need to pull further bloods to look at organ function, perhaps her clotting times, and further investigations. We might place an ECG pads and look at her trace to see is this a sinus tachycardia or is there an arrhythmia present. And then one of the most important things we need to do is we need to try and determine why this abdomen is distended. Is there organomegaly or is there fluid present? And we're going to do that with patient-side imaging. So in the next video, we will look at how we assess this patient and perform ultrasonography.